Hey, you're live.
Hi everyone, sitting on with Dr. Emer's office. We are testing out our favorite new device. It's the Aerolase Era device. So this laser, if you look at it, we have a few of these little light pods from Aerolase. We have a white one, a gold one. Now we have this really beautiful bluish silver one. This actually has the capabilities of being like a fractional laser and an ablative laser. And it's, of course, like Aerolase is known for, safe for a bunch of different skin types. So we are going to be doing a treatment here. And this is going to be a subablative treatment. It's going to act like a laser peel. It's going to give our patients some glow. If anything, some very minimal peeling that'll be over in about a day. But what she's going to see is that her skin looks invigorated, it looks vibrant, and it's a really nice way to kind of end the winter here in LA and go into springtime. So what we are doing here, we did a couple little test spots out in her jawline so you can see that she has developed some very, very mild redness. We did some a little bit closer to the skin up here on the cheekbone, and she's just a little bit red. It's not uncomfortable. So we're gonna get started. It's a little loud, so bear with me. But what you see is a little bit of frosting on the skin. And this little bit of white is the subablative heat that is penetrating. It's sending heat into the deeper layers of the skin to stimulate collagen and stimulate that turnover and the brightness in the skin. But it is not burning the surface. So this is a very safe treatment for darker skin types. It'll be right next to your eye. So we're gonna just continue to keep this distance away from the skin. And as long as we're seeing that whitening or a little bit of wet look on the skin, we're really achieving what we want here. How's it feel?
Not too bad.
What does it feel like?
It's just warm, like a rubber band is smacking the skin.
Yeah. So it's a pretty typical laser feeling, like a little tiny rubber band. Sometimes it's like a little prick or a little snap. And we're just gonna cover the whole area. I'm curious to see if she peels at all tomorrow. And you can see that we're just going to stack this energy. So this is a nice quick treatment. You can do 1, you can do 3 passes. And this is something that you can do either like monthly or every few weeks to just kind of keep your skin in shape and keep it looking its best. We do love to combine our Aerolase treatments with other treatments in office, things that do deeper heating or deeper radio frequency. The Aerolase nanotechnology pairs really well with it because you don't necessarily prolong the downtime. Patients are not uncomfortable. You can see we are causing some heat. Maybe right up here. Are there any questions about Aerolase?
For the people who are just joining, can you tell them what this is again?
Yeah, so welcome guys. This is the Aerolase Era device. And what we can do with this is we can customize this device to be fractional or fully ablative. And so it is something that is a little bit safer for darker skin types. And it really opens up the variety of options that patients have when they have ethnic skin color and dark skin types. You can now have a laser facial or a deeper laser that is safe for you. So of course it's always important to select wisely. Go ahead and turn. And what we're doing right now on our patient is a sub-ablative laser. So we are sending the energy deeper than the surface of the skin. And we are getting a lot of vibrancy to the skin because it's going to cause a little bit of cell turnover, but we're not damaging the surface. So even though you can see that we're getting some heat, what the visible poofs that you're seeing are actually from the vaporization. So you're getting a little bit of water on the skin. If you were able to see very closely, go ahead and turn your head again. You actually get this shiny appearance on the skin. Let me see if I can get you to see it. You get a little bit of shine on the skin, and that is the vaporization. That is the point that we're looking for. We're going to continue through.
What's the downtime?
There isn't really any downtime with it. About a day, if there's any peeling, it'll be a day or so, and then the skin just looks a lot brighter. What this is going to do is it's going to give you the equivalent appearance of having a chemical peel, but with significantly less downtime. So that's a really cool thing to incorporate into the practice. I love chemical peels. They do well for the skin. Dr. Emer and I definitely believe the biggest back to a chemical peel is, you know, how safe is it to do all year long when we consider the sun exposure factor. And oh, good time to talk. So this is going to adjust. It takes a moment. This device takes a moment to kind of recalibrate itself. So during that time, we'll kind of talk about it. So the reason that this is great is because you're getting the benefits of a chemical peel with less downtime. So she may peel for a day or so, and after that, she'll have that fresh new skin because it's not damaging so much of the surface. So we're ready to go again. It's not damaging the surface. She's going to have a little bit of evening out the skin color, and it's going to be mild. So it's something that she can do frequently in her skin. And the drawback to a chemical peel itself is always, well, what's the downtime? So most of them are about 5 days, and with this, you're just looking about 1. Any other questions?
That's all the questions for now.
Awesome. She's doing awesome. She's really not in any pain.
Nope.
And we're going to finish up here, and we'll see how she's looking tomorrow. It'll be really exciting. Thanks for tuning in, everyone.